846, good morning. I'm Brian Gallagher. We have a guest in studio from Central District Health Department. Jody Gerritsen has come by to talk about school shots. Yes, we're going to talk about school shots as school gets ready to wrap up, and she's here to explain why. First, welcome back.
Thank you, Brian.
Let's talk about those shots.
Yes, as the next school year is going to be approaching before we know it, it is time to think about vaccines for specifically those children who will be entering kindergarten, 7th grade, and even possibly those that are entering preschool programs. It might be time for them to get some updated vaccines.
So with these vaccines, and for those who may be a new parent or maybe they're new to the area and trying to get all acclimated, what are the key vaccines that they need to be thinking about and prepared for?
Yeah, so at 7th grade, those children will need to definitely get a tetanus vaccine with pertussis. It's time to think about the HPV and meningitis vaccines as well. And so those would be the vaccines for that age group. For kindergarten, and it may depend if the kindergartner has gotten vaccines. They could have gotten them as early as age 4. So if they went in for a visit, their doctor may have already given them. But the measles, mumps, rubella, varicella vaccines, polio, and diphtheria, tetanus, pertussis vaccines. So that's a lot. So most importantly, it's good for parents to check with the child's doctor to see what records they have and what vaccines are needed. You can check with the schools as well to see what's required.
Because of the pandemic now, 3 years plus, we've all had to adjust to new schedules, new expectations, new boosters, and so on. It appears that much of the key concern has passed. However, we know it's not completely over. Mm-hmm. That's just reality. Mm-hmm. This is something that we're going to be dealing with for a long time. What is an ongoing recommendation for shots for adults as we get to summer and being around people and so on?
Yeah. So, and in fact, there has been an updated recommendation on those 65 and older that they can get an updated COVID booster if it's been more than 4 months since their last vaccine. So that just recently is a new recommendation. So otherwise for adults, it's time to think about if they have an updated tetanus vaccine. This is the time a lot of people are going to be doing more work outside. So it's a good time to look at when was your last tetanus vaccine. If it's been more than 10 years, it's important to get that. Or if you don't know, don't have any records, it's important to get a tetanus vaccine.
And for those of us over 65, another thing to think about too, shingles.
Yes, shingles, and actually 50 and older. If you're 50 and older and have not had a shingles vaccine, it's important to look into that.
Boy, 50 seems like a long time ago. But that's so much for my editorial comment. All right, so there's a lot of different ways that you can do the right things to try to better your health prospects. If you do have questions, you can always contact Central District Health Department.
Yes, you can always call us at 308-385-5175.
Jody Gerritsen with all the good info. Thanks. Always a pleasure.
Thanks, Brian.
Good morning from AM 1430 KRGI 105.5 FM.